Now, there are a small number of people who will go on the carnivore diet, say for 90 days, and they don't quite have the results that they see. Maybe the weight hasn't come down. They're not feeling quite as good as they hope they would. What do you think are some of the main mistakes that people make that results in them not achieving the results they'd like?
Yeah, every time I talk to somebody who claims to have done the 90-day carnivore challenge, and I kind of question them and dig down into what actually happened, I find that there's a lot of sauces, a lot of rubs, a lot of condiments, a lot of coffee, a lot of protein shakes. And they're like, well, I mean, it's protein. I thought that was carnivore. It's very easy for people to either genuinely misunderstand what we're doing here or blindly say they did that when they really didn't do that. And I don't think they're trying to trick anybody. I just think they're like, well, I had no idea. We have a lady in our private community who thought she was doing carnivore exactly right and just not getting the results she was looking for. When I questioned her at a deeper level, I found out she was eating a keto brick every day, which if people don't know, a keto brick it has some of the cleanest ingredients of any keto treat, but that's not carnivore. And so once she got that out of her diet, immediately she started to lose more visceral fat and started to notice reduced levels of inflammation. And so anytime somebody says, I did 90 days of carnivore, it didn't work for me, a few questions will often reveal maybe you ate a more meat heavy diet for those 90 days, but you didn't in fact really do carnivore for 90 days.
Hmm. Yeah. So you think the biggest mistake people make with the carnivore diet is they're not on the carnivore diet?
And well, and I think it's because they don't understand the basic principles of what we're trying to accomplish here. There's nothing magic about meat or eggs. And a lot of carnivores go, wait, what? When I say that. But what the carnivore diet is the ultimate elimination diet. The benefits come from everything that you eliminate. Now, definitely, there are people out there with vitamin and mineral deficiencies, with fatty acid and amino acid deficiencies, that when they add more meat to their diet, they get healthier. They feel better. Their mental health is better. Absolutely true. But for the vast majority of people, especially people with diabetes, with metabolic syndrome, with hypertension, obesity, fatty liver, it's the elimination part of carnivore that works the magic. It's not magic, it's physiology. But it feels like magic because you can eat as much as you want. And all of these chronic medical conditions that you previously associated with, oh, I'm just eating too much food. Turns out, no, that's not the case at all. You were just eating too much of the wrong foods, or in many cases, you're eating too many food adjacent products that pretend to be food but aren't really human food at all.
Hmm. And another thing that a lot of people seem to struggle with is some people naturally have larger appetites. So there are a lot of people who can go on carnivore, they can eat all the meat, they can eat all the dairy they like, and achieve the body of their dreams, see tremendous results. But do you think there is a percentage of people who do need to eliminate dairy almost entirely to get to their goal weight?
100%. Yeah. And I'm one of those. If I continued carnivore, but I added in the amount of dairy that I would like to consume every day, I would be 20 or 30 pounds heavier within 3 months, and it would not be muscle. It's very, and this is one thing I agree with the vegans on. There is no place, if we're being ancestrally appropriate here, there is no place for dairy in the diet of an adult human. And I'm sorry, this will make some people mad, but this includes raw dairy. This includes raw milk, raw cheese, raw kefir. Though I think the more you ferment dairy, the less inflammatory it is. Absolutely, I agree with that. But that does not make it healthy. It just makes it less bad. And so I think it's a large subset of people that they can include some dairy as long as they moderate that and limit the volume, they can do just fine. But there's a significant subset of people that need to realize dairy is for babies. It's not for adults. And to the degree with which you overconsume dairy, you're going to have higher levels of inflammation, higher levels of visceral fat, higher levels of decreased mental health. You're just not going to do as well. And this hurts a lot of people's feelings. And I'm sorry for that, but dairy is for babies.
Um, Another thing with dairy that I see is that is often not discussed very often is the hormones that dairy contains, things like estrogen, things, those sorts of things. Many people talk about the effects that the carbohydrates have in the dairy and the inflammatory properties that come as a result of the pasteurization. But do you think that some of these hormones that are in dairy are affecting human health?
Absolutely. Now, and also let's be very clear about this. When you say hormones in dairy, a lot of people think that you mean added hormones. And even the hormones that are added to the dairy cattle, the most common one is bovine growth hormone. It's a naturally occurring hormone. They just give the dairy cows higher doses of it, right? And so milk is full of hormones, even human milk. You hear there's a subset of people who are like, oh, colostrum is great. If you can find breast milk, that's great. No, that's also for babies. It is full of hormones that are in there for a specific reason, and the reason is to make you grow and gain weight. And so, if somebody's an elite level bodybuilder, they might want to bulk up and then cut down. There might be a place for dairy in your diet because the hormones are definitely going to make you bulk up. That's what they're there for. But for people who are trying to get as lean as is healthy, and that's not too lean. There's a definition of what body fat percentage is in a healthy adult male and female. Dairy's not going to help you get that most of the time.
Another thing that really holds people back when they're starting the carnivore diet is they go 2, 3 days, maybe they're feeling good, but then the sugar cravings knock on the door. All they can think about is the Oreos or the Pop-Tarts. What is your advice for someone who's on carnivore and these things occur?
Well, I love it when people go into their carnivore challenge with their eyes open. And I try to preemptively tell them, look, you're probably a sugar addict. And that's okay. But if you go into carnivore and you're not aware of that fact, about 3 to 7 days in, you're going to be jonesing, and you're not going to recognize it for what it actually is, which is carbohydrate withdrawals. Just like if you tell somebody quit smoking, you'll feel better the minute you do. You're setting that person up for failure, because when the nicotine withdrawals kick in, if you haven't warned them in advance, hey, it's going to suck. Okay, for 3 to 14 days, it's going to suck real damn bad. Then they think, well, gosh, I felt so much better when I was smoking. Maybe I should just go back to smoking. Maybe that's actually healthier because I feel better when I smoke. Same thing for sugar addiction. If you don't warn them in advance, hey, you're going to go through withdrawals, and it might suck a little bit or it might suck a lot of bit, depending on your physiology and how long you've been a sugar addict. I think you're setting people up for failure. They need to know that going in. They need to really know what it is and what to expect, so that when it does happen, they're like, oh, this is sugar withdrawal symptoms. This doesn't mean carnivore is bad for me. Here, I'm having some reaction to carnivore. I'm just withdrawing from the sugar, and that's going to take a few days for my body to adjust.
Mhm.